Hi, Dr. John Carazella here, and today marks the beginning of you getting to know me a little bit. I want to start having a discussion with a number of people out there and feel that this is as good a venue to do that as I could possibly imagine at this day and age. We live in a wonderful world where we can express our feelings and let people get to know us from the comfort of our own home and from in front of our own desk. And that's exactly what I would like to do. Today what I want to do is tell you a little bit about me, about myself, what some of my thoughts are, and where I want to go with all of this. This will basically be the introduction on my blog. We will see this going forward as a basis for who I am and what I do. Basically, I was born in Philadelphia, Pennsylvania in 1956. I later grew up in Wallingford, Connecticut. I was very fortunate in Wallingford. I was able to attend one of the most prestigious high schools that there is. I went to the Choate School. I graduated from there in 1974. Following that, I went on to Yale University. I got my BA in 1978 and was very fortunate to be accepted at the University of Cincinnati College of Medicine. I went to the University of Cincinnati between 1978 and 1982. I worked and studied hard and earned my MD in June of 1982. Following that, I was extremely fortunate and, quite honestly, on the backs of a lot of hard work, I was accepted into the University of Cincinnati Department of Orthopedic Training Program. And back at the time, Ed Miller, a very dear friend of mine who was the chairman at that time, chose me as the #1 residency selection for that entering class of 5. I was very honored and very fortunate to have gotten that nod. I completed my residency training in 1987, and during the orthopedic training examinations along the way I placed in the 95th percentile, and again did very, very well throughout. Following my residency, I was approached by Dr. Peter Stern, who is one of the preeminent orthopedic surgeons in the United States. He established a fellowship for hand surgery, and I was honored by Dr. Stern to be asked to be his first fellow in the Mary S. Stern Fellowship for Hand Surgery. He established that prestigious fellowship. It has gone on to be one of the top fellowships in the United States. Again, he asked me to be the first fellow in that program, and I was happy to complete that first year with him. While I have not done a whole lot with hand surgery, I did learn a lot in terms of surgical development, surgical skill, and I became an outstanding technical surgeon as a result of my training both there and in my orthopedic training program. Following my hand surgery fellowship, I went on to private practice. I practiced in Indiana for a year, just outside of Indianapolis, and thereafter I was very fortunate to find an opportunity in Pensacola, Florida, where I practiced in the 1990s, and I moved from Pensacola to Tampa, Florida in 2000. I practiced in multi-specialty groups from 1990 until about 2001. Then I finally established my own private practice in 2001. I practiced in Plant City until I retired. Somewhere in 2007. It was at that point that I got fed up with medicine as an industry, some of the things that I'll be talking about, and I ultimately went on and have done some other things. I still practice a little bit. I practice part-time, mainly to keep my finger in the pie, to maintain some relationships, and to expand my horizons. And one of the cool things is this temporary work that I now do allows me to travel a little bit. And it's been a little bit fun getting around the country, seeing other hospitals, meeting other doctors. As I've been in professional medicine, I've been very engaged. I've been on a number of committees at all of the hospitals I've been at. I've been very active in the inner workings of medicine. I was on the board of directors at the Medical Center Clinic in Pensacola, Florida. I was the administrative head or the director of, or the medical director in the ambulatory surgery center that the medical center clinic built in the late 1990s. I served in that position for a little over a year. Once I got to Tampa, I maintained my active nature on hospital committees throughout, and I was very fortunate in the last year of my active full-time practice to be voted in as the chairman of the Department of Surgery at the South Florida Baptist Hospital. I was very happy about that. It showed the respect of my peers, and I served in that position until I retired from full-time practice in June of 2007. I have done very well. I have a lot of strong credentials, and have been very fortunate in my medical career to be exposed to a lot of people, to have really quite a wealthy experience and exposure to a lot of different styles of practice, a lot of different doctors. I've made a lot of friends, and I've done a lot of good things. So that's a little bit about my background. I hope that serves a little bit to let you get to know me. What I hope to do and going forward is to discuss some of the issues of the day, to tell you why I left medicine, to tell you why I think that a lot of other doctors are leaving medicine. We're going to talk a lot about the current healthcare reforms. We're going to talk about the issues facing medicine today and going forward. And I think that you're going to find this discussion very informative. I hope to bring you a lot of content, a lot of interesting things, and be very provocative. You know, I'm a very smart person. I keep my fingers on the pulse of what's going on. I like to believe that I'm open-minded. I do have a political nature to me, and I am a very political person. I was raised a Democrat in Connecticut. My father was very active in Connecticut politics. He was the chairman of the Judiciary Committee for the Democrat side from the House of Representatives back in Connecticut. Unfortunately, my dad had some issues and some problems as he got older in life. I'm sure that as you all go out there and check on me, you may or may not find some of those. I'm trying to live my life a little bit differently, and I know that I have. I, however, after being exposed to Democratic politics in early life, have become quite conservative. However, I believe that my basis is built upon, individual achievement, hard work ethic, getting things done, being rewarded for innovation and risk-taking. And at the end of the day, when you create value and wealth, you should be properly rewarded from it. You should not be punished for creating value and wealth. And at the end of the day, I believe in giving back. And I do give back in time, in money, and other ways. I'm a very generous person, and being conservative in my views does not mean that I'm selfish or self-centered, as I'm sure you will all get to know as time goes by. So with that, I'm going to say that's today. I appreciate any comments for this video that you might have, and let's move forward and see if we can make this an interesting place to rally around, an interesting place to log on to from time to time, and really just have some fun. Thank you.